a brief intro. Like Miss Allison mentioned, I am a third-year student who goes to the Chicago School of Professional Psychology, working on getting my doctorates in psychology. And I have a primary interest in working with neuropsychological assessments.
And like was recently mentioned, my name is Dori Menukalaba, Dori for short, and I'm currently a student at Loma Linda University studying clinical psychology as well, with an emphasis on the disadvantaged economically, environmentally, and educationally.
Hi, everyone. My name is Loven. I'm a second-year doctoral student at Pepperdine University, and my clinical interests include cultural neuropsychology and just diverse mental health care.
And I'm Montgomery, working from the Chicago School of Professional Psychology with Lindsay as well, working on my second year right now with an area of interest in neuropsychology and severe mental illnesses such as schizophrenia and bipolar.
And so we are currently placed at the Pickup Family Neurosciences Institute at Hoag Hospital. We study neuropsychology, which is the study of brain behavior relationships. We typically see individuals with cognitive concerns who may have known or suspected neurological or neurodegenerative conditions, and we like to assess their thinking skills such as memory, attention, processing speed, language, and executive functioning. And then based on the results of this testing, we can sometimes help to clarify the etiology, which just means like if there is concern for a neurodegenerative process, such as Alzheimer's disease, and we can also make treatment recommendations and referrals if needed to aid the physicians in their treatment plans. Some of the primary populations that we work with are going to be individuals with dementia and memory loss. This can be illnesses such as Alzheimer's disease, dementia with Lewy bodies, frontotemporal dementia. And then we also work with patients with movement disorders like Parkinson's disease, Huntington's disease, or atypical Parkinsonian syndromes. And then we work with individuals with multiple sclerosis or other neurological conditions like epilepsy, stroke, autoimmune disorders, or individuals with traumatic brain injuries. And then this is just going to be a brief table of contents on today's discussion, starting with what is sleep?
So what is sleep? For most people, people think it's taking a nap or when they go to bed at night, which is kind of true, or in some cultures like taking a siesta, but it's actually a more complicated process. So sleep is basically a predictable cycle between two major phases: non-rapid eye movement, which is non-REM sleep, and rapid eye movement, which is REM sleep. Non-rapid eye movement, non-REM, is further subdivided into three other stages numbered 1 to 3. And in each phase or stage, it basically represents how deep sleep is and different brain waves or muscle tones, or as the name implies, whether there's eye movement or not. As also the name implies, non-REM is characterized by the absence of eye movements, while rapid eye movement is characterized as REM. So what are the stages? As I mentioned before, it's a cycle happening throughout the night and usually starts with non-REM stage 1. Then it goes to stage 2, stage 3, and finally REM. And the cycle typically lasts about, there are typically 4 to 5 cycles that happens during the night. And the first cycle usually lasts 70 to 100 minutes to complete fully, while the remaining cycles last about 90 to 100 minutes. As you progress from cycle to cycle, from 1 to 2 to 3 to 4 and 5, and et cetera, as well to 5 the max, REM, the amount of time you spend in REM increases from however low it starts to up to 30% later on in the night. So here are the sleep stages. In stage 1, it is the lightest kind of sleep. And in this stage, you can easily be awoken. This stage lasts up to 7 minutes. In stage 2, this one is a little bit more deeper than stage 1. it goes up to 25 minutes. And while it is deeper than stage 1, you can still be awoken with heavier stimulation. So it's not as, you can't easily be awoken as you would with stage 1. Stage 3 lasts about 40 minutes. This one is more deep sleep. And if someone were to wake you up in that stage, you'll wake up feeling a little bit groggy. Stage 4, which is REM, this one is the last stage and is responsible for dreaming. It lasts up to 40 minutes and is characterized as total body voluntary muscle paralysis, except for the eyes, because as I mentioned earlier, in REM sleep, the eye muscles are still operational. A little bit interesting fact, apparently this total body voluntary muscle paralysis is taught to prevent your dreams from being manifested to your actual muscles. So just a little interesting fact. Here is a video that will help you to summarize what we talked about so far.
Understanding our sleep cycle gives us insight into how our sleep patterns work and can help us identify reasons why our sleep may be disturbed. We have 2 main types of sleep, non-REM and REM sleep. Non-REM sleep is characterized by 3 stages of sleep that progressively deepen from light sleep to restful sleep to deep sleep. REM, or rapid eye movement sleep, is characterized by dreaming and is the state in which restoration of our brain and body functions occurs, including energy conservation and memory consolidation. We cycle through stages 1, 2, 3, and REM throughout the night. Each cycle takes approximately 90 minutes and repeats throughout the night. Also, as the night progresses, we increasingly spend a longer period of time in REM, which leads to sleeping becoming more restorative or more restful the longer we sleep. So let's talk about each stage individually. In stage 1, we are in transition between being awake and asleep. This is a state of very light sleep, and when we are awakened in stage 1, we may claim or feel we weren't sleeping. Stage 2 is a light stage of sleep and is characterized by the slowing down of brain waves. Stage 3 is a stage of deep sleep. When we are woken from this stage, we are often confused and disoriented. This is the stage during which bedwetting, sleepwalking, or night terrors are experienced. Stage 4, or REM stage, is the last stage in this cycle. During this stage, the eyes usually move fast in different directions and breathing patterns become irregular. Our limbs may also become paralyzed, though the feeling is temporary. People who are awoken from this stage may have bizarre tales or wild dreams. Once we leave REM sleep, we start the cycle all over again. Our sleep patterns are impacted by a range of factors, including our stress levels, low mood and depression, worry or anxiety, physical health conditions, medications, and worry about sleep. Alcohol and many prescription drugs can help facilitate stage 1 and 2 of sleep, but often have detrimental impacts on our more restorative stage 3 and REM sleep.
All right. Thank you, Lindsay. I hope this perfectly summarized what we talked about so far, because I know it can be a little bit heavy. In terms of examples of sleep disorders, we're familiar with a couple, such as insomnia. And insomnia is more of the generic term for any illness that causes difficulty with sleep initiation or sleep maintenance. And this one is most commonly related to stress, poor sleeping environments, irregular sleep schedules, excessive mental, physical, or chemical stimulation. Parasomnias is basically defined as abnormal behaviors or events arising for sleep. And this include sleepwalking or sleep terrors. And then we have obstructive and central sleep apnea. While central sleep apnea is defined as lack of breathing due to the absence of respiratory effort, obstructive sleep apnea is lack of breathing due to upper airway obstruction. So one is more related to the obstructive aspect of breathing, while the other is the absence of respiratory effort. And in this PowerPoint, we're mostly going to be focusing on insomnia and obstructive sleep apnea. Circadian rhythm sleep-wake disorders are basically problems that occur when your body's internal clock, which tells you when it's time to fall asleep and when it's time to wake up, is out of sync with your environment. So if you're working like a night shift or you're taking a long flight and you're feeling jet lag, so this would typically fall under circadian rhythm sleep-wake disorders. Lastly, narcolepsy is defined as excessive daytime sleepiness. So it's more than just taking a nap during the day. It just happens regularly throughout the day. So there are some tests that are used to assess for sleeping. And the primary testing modality is called polysomnography. And this includes ECGs, which is basically a test that checks your heart rhythm and electrical activity. Then we have EEGs that measures brainwave activity, EOG that measures eye movement. And as I mentioned earlier, in non-REM, there should be no eye movement, but in REM, we should be seeing eye movement. And EMG is used to measure muscle movement. And last but not least, oxygen saturation is used to evaluate your oxygen, your need for oxygen while you sleep. So it's basically used to verify whether respiration is being performed as expected during sleep without any halts in breathing. And now we're going to pass it over to future Dr. Jimenez.
Thank you, Dory. So I'm just going to go into some reasons as to why sleep is important. So here are some basic theories as to why sleep is important. We have the inactivity theory, which is based on the concept that evolutionary pressure where creatures were inactive at night and they were less likely to die from predation or injury in the dark. So it kind of became evolutionary and reproductive benefit to be inactive at night. Next, we have the energy conservation theory, which suggests that the main function of sleep is to reduce a person's energy demand during part of the day and night when it was less efficient to hunt for food. Then we have the restorative theory, which suggests that sleep allows for our bodies to repair and replete cellular components that are necessary for our biological functions, and those become depleted throughout the awake day. And then the next is the restorative theory, which suggests, I already went over that one. The next is the brain plasticity theory, which suggests that sleep is necessary for neural reorganization and growth of our brain's structure and function. And then, so we're going to go into some common sleep myths. So one common sleep myth is that snoring is not harmful. This is a myth because it can signal a life-threatening disorder, which Dory briefly went over, called sleep apnea. Sleep apnea causes these pauses in our breathing that can last for seconds or minutes and to dozens of times each hour. These pauses disrupt our sleep and cause you to wake up and sleep only lightly, which can make you feel extremely tired throughout the day. Additionally, it reduces the amount of oxygen in your blood vessels, which can increase the risk of heart disease. And then sleep apnea can also increase the risk for high blood pressure, stroke, and diabetes. Another myth is that you can catch up on sleep. So long-term sleep deprivation puts you at risk for health problems and can impair your safety and work performance. Additionally, sleep deprivation has been linked to obesity, high blood pressure, negative mood and behaviors, and decreased productivity at work. In addition, with safety issues at home, at the job, or on the road. And then catching up on sleep might help you reduce your daytime sleepiness or drowsiness, but it will not reverse the effects of not getting enough sleep or getting enough quality sleep at night. Additionally, the last myth we're going to talk about is that the older you get, the less sleep you need. While sleep patterns can change as we age, the amount of sleep that our body needs does not usually change. Older people may wake up more frequently throughout the night, and end up getting less sleep during the overnight hours. Older adults are also more likely to be taking medications that can interfere with our sleep. And this doesn't mean that their need for sleep is not drastically less than that of younger adults. Then we have some research on sleep. So the National Sleep Foundation does recommend that for adults between 18 and 64 years old, we get 7 to 9 hours of sleep per night. Adults over 65 may need 7 to 8 hours. Between 10 and 30% of adults struggle with insomnia. 2 to 9% of adults are affected by obstructive sleep apnea. There are also some gender differences. So for example, women typically report poorer quality and more disrupted sleep across various life stages compared to men. And then we also know from the research that technology might interrupt our sleep. And so it is noted that 89% of adults and 75% of children have at least one electronic device in their bedrooms. And now we have some common causes of insomnia. So 35% of adults in the US will report sleeping for less than 7 hours per night on average. And as we just went over, the recommended average night of sleep is 7 hours. So some common causes of insomnia could be stress and anxiety, a poor sleeping environment, such as an uncomfortable bed or a bedroom that's too light, noisy, hot, or cold. Some lifestyle factors such as jet lag, a late work shift, or drinking alcohol or caffeine before going to bed. Some mental health conditions, in addition to anxiety and stress, can be depression and schizophrenia. And additionally, some physical health conditions such as heart problems, other sleep disorders, and long-term pain. And certain medications, for example, some antidepressants, epilepsy medications, or steroid medications. Now I'm going to hand it off to Loven.
So it is no surprise that sleep deprivation can have a variety of different consequences on our physical health, but what about the large-scale impact that it can have on the brain? So sleep deprivation can cause difficulties with attention and mental alertness. Research has shown that in a well-rested person, alertness remains relatively stable throughout the day with very little fluctuations, but this was not found in participants in the research study who endorsed chronic sleep deprivation. This is particularly concerning because attention sets us up well for other tasks throughout the day that might be more cognitively complex. Lack of sleep was also associated with problems with executive functioning. So executive functioning in a nutshell refers to higher order cognitive tasks that require more cognitive flexibility and more complex problem-solving skills. So studies have found that people who have this chronic sleep deprivation might find it difficult to engage in some of this higher order thinking, specifically being able to focus on information while being able to simultaneously ignore irrelevant information, or being able to sequence thoughts and behaviors, or updating information as we receive new information from our environment. It's also been associated with go ahead and go back one slide. It's also been associated with learning and memory problems. It can impact our ability to learn and remember new information, which can impact our day-to-day functioning and our ability to incorporate this new information. So think about remembering daily tasks or keeping track of your appointments, or remembering or keeping track of previous conversations. All of this can be impacted if you're not getting a good night's sleep. And lastly, there could be altered emotional functioning and processing. So research has shown that lack of sleep can alter overall mood, but it can also alter our ability to process our own emotions and the emotions that we experience from other people in our environment. So next slide, please. Thank you. So in terms of some more research, total sleep deprivation is associated with increased activation in the bilateral prefrontal cortex and parietal lobes. So what that essentially means is that the region that is associated with attention, impulse control, memory, and cognitive flexibility gets impacted if we don't sleep enough over a long period of time. Research has also shown that chronic sleep deprivation may have an association with increased anxiety and memory impairment. So there was one research study in particular that was conducted to see if chronic sleep deprivation led to anxiety-like behavior and memory decline in lab rats. They basically tracked these things by putting the lab rats in maze tests, and they found that the rats that were more sleep deprived did worse on the test, made more errors, and displayed more erratic behavior while running through the maze than the rats that were well rested. The same study also found some motor disturbance as well. So that might suggest that the rats were having more difficulty with their fine motor movements than the lab rats that were well rested. Next slide. Thank you. And so this is a video that kind of goes over what we've talked about, but also mentions if it's a bad thing to get too much sleep.
We really wanted to capture the sleeping habits of people across the entire globe. So obviously there have been many smaller studies of people in laboratories, but we wanted to find out what sleep is like in the real world. How do real people sleep? How much sleep do they get? And what effect is it having on their brain?
We had 44,000 people volunteer their time to participate in our study, which was really quite amazing.
People who logged in gave us a lot of information about themselves. We had a fairly extensive questionnaire. They told us things like what medications they were on, how old they were, where they were, what sort of education they'd received, because these are also factors that might have contributed to some of the results. In some cases, we wanted to rule things out. In other cases, we were really interested in looking at those factors. Things like aging. Does sleep vary as you get older? And if so, what is the effect that it has on your performance?
So we found that the optimum amount of sleep to keep your brain performing its best was between 7 to 8 hours every single night. And that corresponds to what doctors will tell you need to keep your body in tip-top shape as well. We also found that people who slept more than that amount were equally as impaired as those who slept too little. I think we're all keenly aware when we don't get enough sleep. You can feel it in your body and you might feel that your brain is slightly foggy. But what we might not realize is that some of our brain functions are more impaired than others. And specifically that our ability to solve some kind of complex everyday problem like setting the timer on your coffee maker or doing your taxes, you're not going to be able to do that as effectively if you're not getting enough sleep.
Actually, we have a lot more that we're going to do with this data because we collected a lot of other information about people that we even haven't managed to look at yet. What we wanted to do is to...
Okay. So go ahead and move on to the next slide. Oh, actually, can you go back just for a second? Sorry about that. So another piece of information that I wanted to discuss with you all, according to JAMA Neurology, there was basically an association with excessive daytime sleepiness in cognitively normal elderly adults. And they basically showed an association between too much sleep and the buildup of this plaque called amyloid in the brain. And they found that over the course of time, these amyloid deposits in the brain tissue could be the first known preclinical stage of Alzheimer's disease. And it can precede some of the known symptoms of dementia. So next slide, please. Thank you. And so does lack of sleep impact everyone the same? The short answer is actually no. Genetics have a huge role in shaping how we react to sleep. Research has found that there are slight differences in how much sleep we require, as well as how well we're able to recover from the lack of sleep, according to some genetic variables that exist. Research has also found that adults are better at recovering from the effects of sleep deprivation than adolescents. Interestingly enough, they showed that teens are more likely to make riskier decisions due to lack of sleep, which kind of ties into my previous point on how impulse control can be impacted due to lack of sleep. And additionally, some studies suggest that there are gender differences in how well we're able to recover from lack of sleep. They found that women are generally able to recover better from lack of sleep than men, but there was variable information that was available in terms of the gender differences and how much sleep we require. Some studies suggested that women require generally more sleep than men, but with the caveat in mind that there are other variables at play, such as age, medical conditions, life stage, for instance, if you have children or if you have a stressful job, those can all play a role in how much sleep we require. So yeah, I'll go ahead and hand it off to Brett.
Okay. So we're going to jump into the next topic, which is briefly talk about medications, and we're going to talk about some medications that might be used to help with sleep. Okay, so are medications that help us sleep beneficial? I think this is kind of a twofold answer. So yes, kind of like what one of the videos had shown earlier, medications can help us kind of initiate sleep into those phase 1s and phase 2s of sleep. And some of those common medications that are prescribed to help with sleep can include medications such as like benzodiazepines, hypnotics, antidepressants, and in some instances, even antipsychotics. And what they do is they depress the central nervous system to help us relax and help us kind of drift off into sleep. Now, while that sounds great, there are some concerns with sleep medications. So some research has found that there is an increased risk of Alzheimer's disease when medications that are used to help us sleep are used at higher than recommended doses or too often. So what that means is, if we're taking these sleep medications too much, they can actually contribute to some disease processes, just like, lack of sleep does in general, like Loven was saying. So these medications can often make you wake up feeling groggy or tired as well, and that can increase the risk of falls and day-to-day cognitive impairment with regular use. Now here at Hoag, what we do is we do the neuropsychological testing. So sometimes when we have patients come in and we see they're not performing up to the expectations, if we look at their medications, sometimes, they'll be on some types of medications that can affect these things, like I stated earlier. It is important to note, however, that we are not medical providers, just providing this information. That way you guys can kind of look at your medications and start to think about it and maybe start a conversation with your prescribing physician to weigh the potential costs and benefits of taking these medications. So like I said, a careful review of the medications with that provider is kind of just what we're recommending, just because we do see a lot of patients that come into our clinic that are prescribed a lot of these medications. Okay, so you guys have been given a lot of information today on what sleep is, the different cycles, some of the evolutionary theories of sleep. So I want to just briefly talk about, some healthy sleep habits, some things that can affect our sleep, and just kind of reiterate them. So what we eat or drink can definitely affect our sleep, whether we're drinking, high sugary drinks before we go to bed, or eating high caloric foods before we go to bed, going to sleep on a full stomach. I'm sure you guys have noticed that if you go to sleep after drinking, something high in sugar or maybe a really big meal, at first it might be easy to fall asleep if you eat that big meal, but over time you might wake up more often. The medications we take, just like I just discussed, our daily schedule. So if we notice that our schedule has a lot of activities at night, whether that's, reading stimulating things, or maybe you do some work at night, you might notice that it's more difficult to fall asleep. So that daily schedule can really affect us at night. And stress. Maybe some people have noticed that if you're more stressed at night, you lay in bed, you start to think about all those things that happened during the day, or maybe the things that you have to do tomorrow, or a fight you had with a loved one, or whatever it is. All these variety of stressors can kind of go through our mind when we're trying to sleep and make it more difficult to fall asleep, and sometimes even stay asleep. You wake up in the middle of the night and the first thing that pops in your head is, the things that you have to do the next day. So I want to talk about something called sleep hygiene, which is a term used to refer to healthy sleep habits that can improve our ability to fall asleep, or what we call sleep initiation, and stay asleep throughout the night, which is what we call sleep maintenance. Okay, so the healthy sleep habits, I'm just going to go over a couple of them briefly. I'm sure maybe some of you guys have heard these before. They might not apply to everyone, but I just want to cover all the simple basic habits that are beneficial. So the first thing you want to look at is you really want to establish a relaxing pre-bedtime routine. That's not, doing work up until bedtime, or maybe having an very, very engaging conversation with somebody. You want to start to kind of relax before you go to bed, maybe an hour before you go to bed. You can start reading a book, some light reading, nothing too stimulating. Taking a warm shower, some people having a warm cup of tea, whatever it is to let your body know that it's time to start, shutting down a little bit and getting ready for sleep is really, really important. You want to make your bedroom a quiet, relaxing place. Your bedroom should really only be used for two things, sleeping and intimacy. So if you can make your bedroom as quiet as possible, maybe make sure the window's closed or the door is closed. Make sure that you don't really hear all the things going on. If that's an option, I know some of us live in apartments and have some thin walls and loud neighbors. So, there's also devices you can use like white noise machines that can help with that. But you really want to try to make your bedroom a nice, quiet place. You also want to make it relaxing. So what that means is you want to make sure that it is a comfortable temperature, not too warm, not too cold. The bed is nice and soft. If you can get some nice sheets, that's good. You want to make sure that it's just nice, quiet. Every time you go into your room, you start to get relaxed. That's what's most beneficial. Okay. The next thing is you want to keep a consistent schedule. So what that is you want to go to bed at the same time every night, and wake up at the same time every day. That includes weekends, that includes vacations. If you get your body on this good, consistent schedule and routine, you might start to notice that you're getting tired at the same time every day, which kind of goes into going to sleep in the pre-bedtime routine. And then if you wake up at the same time every day, your rhythm throughout the day will kind of be the same, which will go into the rhythm at night, and everything will be nice, consistent schedule. If you're noticing difficulties with your sleep, you can actually track your sleep, have what we call a sleep log. Make note of what time you wake up during the day, what time you wake up in the morning, what time you go to bed at night. If you wake up during the night, all these things to maybe look at and see what areas you can improve in your sleep schedule. So tracking your sleep can actually be pretty beneficial also. A couple more things for sleep hygiene. One thing is if you don't fall asleep right away, maybe within about 20 minutes, it's actually a good idea to get out of bed and go into a different room. Now you want to be mindful that when you go into the other room, you want it to be a nice, quiet, relaxing place also. You don't want to go into a room where someone's watching TV. It's a really, really loud movie. All the lights are on. That's really, really stimulating. You really want to go into another room that's just quiet, comfortable, where you can just kind of relax, maybe read a book under some soft light, just to kind of, relax yourself and relax your mind. And then when you start to get tired again, go back to bed and see if you can fall asleep. You want to avoid screen time at least 1 hour before bed. So what that means is that's TV, that's phones, that's tablets, all these different things with all these different lights that are going directly into our eyes, which can actually stimulate certain areas of our brain to make us think that it's time to be awake. So avoiding screen time at least 1 hour is really, really important. Reading before bed is good, but if you do it, you want to switch to some old school, just paper books if you can. That way you're not getting that direct light into your eyes. You want to avoid certain things. I talked about this earlier a little bit, such as caffeine, alcohol, and exercise before bed. So as we know, caffeine is a stimulant. So if we drink caffeine before we go to bed, it might, make it more difficult for us to fall asleep or stay asleep throughout the night. So it might be something to avoid. I know some people drink coffee before they go to bed, but if you're having difficulty with sleep, that might be one thing that could be affecting it. Alcohol, like the video had stated earlier, alcohol might help us fall asleep, stage 1, stage 2 sleep, but it doesn't really help us stay asleep throughout the night. It can actually break up our sleep and make us not get as effective sleep. So if we don't get as effective sleep, then we might be groggy the next day. Exercise several hours before to bed. Exercising is great. You just don't really want to do it right before you go to bed. It can kind of stimulate us, get all our, juices flowing and all that, and make it more difficult for us to fall asleep. So avoiding those things several hours before bed is recommended. Okay, and the last one that I think is really interesting and important, something that I didn't know until I came to Hogue actually, is if you want to remove the clocks from the bedroom, or at least put them in a place that you can't see them during the night. So if you think about it, if you wake up during the night, what's the first thing you usually do? You look at the clock to see what time it is, and then you start calculating how many hours of sleep you have left. So let's say if you wake up at 6 a.m. usually, and you wake up during the night and it's 3 a.m., you start to think, okay, 3 more hours. Then you fall asleep, you wake up an hour later, 2 more hours, and you start to have those stimulating thoughts in your brain that you start to think about your day maybe. So if you put a clock, not facing your bed, you wake up in the night, all you need to know is it's time to go back to bed. Now, with that caveat, though, you want to make sure if you need to be awake, you set an alarm. You just put that alarm in a place that you're not going to look at directly when you wake up in the middle of the night. So that way, when the alarm goes off, you get out of bed, it's time to be awake. Other than that, it's time to sleep. Okay. And that's all the sleep hygiene tips we have. There's a lot more different hygiene tips that are out there. There's books out there as well that you guys can read for different sleep hygiene. Always talk to your providers as well. They should be able to give you some ideas if you need more tips. So that actually concludes our presentation as far as all the information. So we wanted to open this up to questions now, I believe.
Yes, thank you so much. Wonderful presentation. Does anybody have any questions? If you're asking questions, you have to unmute yourselves.
I have a question.
Yes, go right ahead.
Could we talk a little bit about the CPAP machines and what is new in that world of technology?
I can go ahead and start to answer this question. I would say that is going to be a topic to talk with your medical provider about. There are newer machines, which I have heard through my patients, that they've been able to tolerate better. They tend to fit more comfortably, smaller. There are alternatives also to a CPAP machine, although that's kind of